Hi, it's Dr. Daniel Ronel on Western Medicine, Talk 1260 KTRC. We're talking about plastic surgery, and I'm here with my wife, Betsy, and we're talking about giving back to the community. We moved here about 5 years ago from New York, and Santa Fe has really welcomed us, welcomed my family, welcomed my practice, and we are so grateful. We've talked about this before. Giving back is very important to us, and we have a Vanity for Charity program where every few months we donate the
4
profits,
times a year for 1 month each time.
We donate profits of Botox and injectables to a different local charity. I want to talk about something else. We also created a breast reconstruction fund. This is through the Santa Fe
Community
Foundation, which is a huge umbrella organization for a lot of the nonprofits.
They're just
here.
a godsend.
They're amazing.
Tremendous.
Billy Blair, who runs it, is amazing.
Billy Blair, yeah.
So they're administering this breast reconstruction fund, and basically in northern New Mexico there are a lot of uninsured women who cannot afford breast reconstruction. They can have the life-saving mastectomy to remove the breast, which is cancerous, but they can't afford the reconstruction. And that is like, you know, it's like having a face without a nose.
I was just going to say that, yeah.
Okay, but we're married. And it's just such an important, you talk about it, it's just such an important part of being a woman.
I mean, it doesn't matter to all women. There are women I've known here, mostly older women, over 50, I've known here, who have decided against reconstruction and just want to live as their body has turned out to be. And that's fine. I mean, that's each his own. And there's no judgment for or against the reconstruction, and no one should ever make that judgment. Right. Shame on you if you do. But there are women who, older or younger, doesn't matter, who do feel a loss of femininity, a loss of their sense of identity as a woman by losing their breasts. I mean, it goes back to days of the caveman, primitive times. Right. These are a symbol of all kinds of things. To men, to women, and, you know, so in our very primitive mind, some of us, they still do matter as a symbol of whatever that is to us, and we want to project that symbol and image out there.
Yeah, women who go for breast reconstruction, most do actually, they're not doing it to show off, they're not doing it for other people, they're doing it for themselves. Right. It's a very important part of their identity, and you know, it's really a tragedy when women undergo mastectomy and they're told, you know, they're not even told about reconstruction, right. or they're told, sorry, you know, we just can't get it done for you. So we have this fund, and we have
for uninsured women of northern New Mexico
right,
to come in.
Right. If you want to apply to it, you can go to our website and get the application. It's www.danielronelmd.com or the Santa Fe Community Foundation website. Right. They'll have the information there. I mean, a lot of women are getting breast cancer. It's just so
really tragic.
Right, and the women we hear about, the famous people we hear about, they don't have trouble getting reconstruction.
Well, like Christina Applegate has become a real forerunner, or I don't know what the word is, but spokesperson for this. Right. She's a young woman. She's under 40, in her late 30s, I think. She had a double mastectomy, I think out of prevention. Right? I'm not sure. I mean, obviously I don't know this woman, but I thought she found it in one and had a double as prevention. I think she will undergo reconstruction. I don't remember what I read in, you know, People or Us, like any of you have read. I don't remember. But what I love is that she's really gotten bare bones about it and really down to earth about it. And here's someone who, you know, in men's eyes is really hot, and in women's eyes is very pretty, and, you know, some of us might want to be like her, or whatever. And I think it's just really put a new light on her as a person, as a famous person in her career, and as a spokesperson for breast cancer.
Yeah, next week I'm doing a 35-year-old woman. You know, she's got kids our age.
Right. A friend of mine from Sleepaway Camp tomorrow in Boston. She's from Canada. She's going to Boston. She's having a double mastectomy, and she's terrified. I reassured her as best I could. You know, but it's terrifying. Any procedure is terrifying. But the issue with cancer is you can remove it all, you can remove the breasts, the recurrence is the issue.
And the reconstruction, I really find, is a nice, happy chapter, a way to close it and end the whole cancer nightmare, because they can end up very often getting breasts that look really reasonably good, especially under clothing. They can look normal.
Oh, yeah.
And it's a nice way to end this nightmare of cancer.
All right, he just keeps banging his hands, which is why he's smoking. I'm sorry. For those of you watching, yes.
Right, and
I also think for women to whom it's important to have breasts again, that it's moving forward at the same time it's reclaiming what was yours.
Right.
So I think that's just tremendous.
And it's not inexpensive, and our fund is desperately looking for donations.
Donors, absolutely.
Yes,
always
please.
welcome donors.
We're always welcoming donations. We'd love to have a huge endowment so we don't have to keep begging.
Right. We're going to do our next Vanity for Charity. Will be in a few months in the fall, I guess, and we're going to dedicate that one to our breast fund.
Good.
So we can put more money in it. Have we had any takers?
You mean patients?
Mm-hmm.
Yes, we have.
Who have used our fund?
Mm-hmm.
Oh, that's excellent. I mean, that's what makes this all worthwhile, doesn't it? It's like you work hard, you bust your butt, you have your things that you like in life, your material goods, but that's not satisfying. To me anyway, and to Daniel, for us, we know that having what we have and enjoying our lives is nothing without the knowledge that we give back. Because it's all empty otherwise, and we've sort of leveled ourselves. We have things at the same, what we have, we give away the equivalent, and we thrive on that.
Yes, you're listening to Talk 1260 KTRC Western Medicine with Dr. Daniel Ronel and my wife Betsy Ronel. Thank you.
Thank you.